back to Politically Charged, and today we'll be talking about an issue that no one knew could be so complicated: healthcare. I'm your co-host, Alexandria. This is my other co-host, Eleigh, and joining us are Jared and Jordan. With the Republican Party for the third time this year trying to push through a bill to repeal the Affordable Care Act, and Bernie Sanders stepping forward with a tax-raising solution, this hot-button issue has left most of the country wondering where they will be getting their health coverage in the coming months. To start, Eleigh, would you give us some background on Bernie's Medicare expansion plan?
So what Bernie Sanders' single-payer bill that he proposed in Congress the other day is that he wants to expand a type of Medicare coverage for all over the course of the next 4 years through the increases of taxes, but he wants to start off with the people who already have Medicare, and then the next year he wants to extend that coverage to people who are 45 years or older, and then the next year after that to people who are under 18 who want to apply for health care, and then in the final years expand it to the rest of the population as well.
Okay. Now, I know there's been some scuffling about in the private insurance markets as a result of this. I know that, Jared, you have some experience with private healthcare's costs raising as a result of programs like this.
Yes, under the Affordable Care Act. I don't like to divulge on my personal stories, but my family's health insurance got so expensive that we ended up having to switch plans entirely. Even just in the last year, 8 states across the U.S. Have seen healthcare premiums on average rise by 30% in 1 year. And the average deductible across the entire nation, this comes from NBC, is around $6,000 of a deductible, which was unheard of before the ironically named Affordable Care Act. So, if Bernie Sanders' solution is to get government more involved in the healthcare markets, I don't really see how that's going to be an effective solution.
Well, the problem before, I think, was that the private insurance companies were making it higher already. I think people will forget about before the Affordable Care Act, how bad our healthcare system was back then. The whole point of the Affordable Care Act was to expand it. And with expanding it, sadly, it got more expensive. So you have people getting insurance. It saved lives, yes. But at the same time, it's going to have those effects. People like your situation, where people have.
Did it save lives?
Yeah.
Life expectancy is down over the last 2 years.
No, I'm talking about people actually getting insurance.
It helps people that need coverage because they have, they already have disorders and stuff who couldn't necessarily get on private insurance because the fees and the deductibles would be too high to cover somebody who already has, say, cancer or cerebral palsy, something like that. So it saved
somebody
lives
with a pre-existing condition. They weren't going to go take them on it because it'd be too
New York
expensive.
already covered pre-existing. I personally live in New York. Pre-existing conditions are already covered.
Right, but
and
of
I'm
course
talking
this
about
is a way to
the government.
federalize it.
Yeah, so with the government, making it universally and of the Affordable Care, giving everybody, well, not everybody, but making it more affordable people and giving it to everyone.
But it's not affordable.
Well,
currently it's not affordable.
So then, that being said, you said that you switched plans. Was that to another private healthcare plan?
Yeah, it was to another private healthcare plan. Our deductible currently is about $8,000.
So would it not be easier to just go onto the Affordable Care Act if premiums were going so high?
No, because the coverage is still better under a private system. And even with the high deductibles, we're willing to pay it.
And I feel like it depends on the situation you're in, because if people. The reason it didn't work as good as it should is because young people weren't signing up. And it did have that trouble starting up, and you still have young people saying, no, I don't need this because it's too high.
Mm-hmm. So you're going to penalize them instead for not signing up?
Well, for it to work, they need to sign up. They need to sign up.
Well, you're implying that they cannot sign up because healthcare was already too expensive. Why penalizing them makes the situation better? I'm kind of lost.
I think what Obama was trying to do under the Affordable Care Act was to make sure that everybody had coverage, to get everyone on healthcare, because like Jordan said, young people weren't signing up for the healthcare because one, they think that they're young and they won't need it at all in their entire lives, and two, it was expensive. But if you say sign up, the rates will lower automatically as
But
more and
isn't
more
but
people
isn't that a
join.
personal choice to buy health insurance?
I would say it's a personal choice to buy health insurance. However, when you go into the ER, like with an emergency or something that's just horribly wrong with you, they can't turn you away. So then if they aren't covered by health insurance, and this was really the problem that the Affordable Care Act was trying to help with, it falls on the taxpayers to pay for those injuries anyway. So at least if they're covered, the idea was that the burden would be lessened on the middle class taxpayers.
But then how does Medicare fix that?
Right. So then
Because even still, doctors are not accepting Medicare. 1 in 5 doctors across the entire United States will not accept any form of Medicare because the reimbursement rates are too high.
So then, with Bernie's plan, wouldn't they be forced to, though? If almost
No.
everyone is being covered under Medicare, then where are they supposed to go? At that point, doctors are losing most of their clientele.
But no, because it's already unprofitable for them to take too many Medicare patients. There's not enough reimbursement, there's not enough profit incentive in order to take in those customers.
And I think what we're having such a huge issue in our country is that we are sticking with the same, like the Affordable Care Act for like the last 4 years. And we've seen that the Affordable Care Act it's got its flaws, and Medicare has its flaws. It's $50 trillion in debt, and it's currently not working or benefiting the people that are on it. And we aren't focusing on reform. We're focusing on just doing away with it and getting rid of it.
I think the thing is that Republicans for 8 years under Obama preached that they would repeal it and have something in place. You would think after 8 years they would have something in place.
And I agree with you.
Yeah.
I think that they totally failed at that.
They have failed at it. Now this is the third time. This one is with Bill Cassidy, senator from Louisiana, and Senator Lindsey Graham from South Carolina. Now they're revising it. And with this one, once again, it's not perfect. And now it's the same thing. It's the same thing, different people. And it's still going to cost millions of people health care. And so you have to ask yourself, like, is it better than Obamacare?
So you're implying that a success of a healthcare market is the number of people covered, not the quality of the coverage itself. If it's their personal choice not to have health insurance, of course the number is going to go down. I mean, that's just a statistical fact.
I believe that healthcare is a right, but I agree in some sort that
But you believe that it's a right that it should be government mandated?
I believe that everybody should have it, and the government should be able to pay for it. Because when you're paying taxes, you want to know where your taxes are going. Now, sadly, our taxes only go to our military and not to our health
That's
system.
not true
Well,
at all.
yeah,
That's a broad
It's not
statement.
our military
We
budget
do have,
is.
we have one of the largest military.
It
yes,
is the
But
largest.
that's not only where our.
I'm not saying
taxes
only.
are.
I'm talking about
Medicare,
countries in the world,
Medicare and
the
Medicaid
percentage
take
of our
up
GDP and
$1.1
tax that goes
trillion
towards the military
and
is
to
very
to lower costs of our healthcare system. It would be nice if our taxes went there. And I'm saying that.
Yes.
Okay. However, that's not the plan that Bernie is trying to institute, right? He's adding on an additional tax to cover the funding for this new plan. I understand the idea of trying to redistribute the taxes that we're already paying, but then with an additional tax, is that really the best way to go about the new Medicare plan?
It depends on where it goes. If it goes to the 1%, the rich, I think that's more helpful than once again burdening the middle class on everything.
I think what he said in his bill was that he's not going to add this tax onto people's like income tax. It's going to be through state and
Actually,
other different.
He
other
did
different
say there's
taxes.
going to be a 2.2% tax additional
The
to
major-
income.
yeah, the
and then a
majority of it is not gonna come
6.7%
from
additional
income
tax
tax.
to any employers.
Okay.
So the middle class, they might not be the rich corporates, but a lot of them are small business owners. And can they carry an additional 6.7% tax plus 2.2% on their regular income?
And I think that's something that Bernie has to fix in that, because I really only believe that if you're a big corporation, billions of dollars, so you shouldn't be burdening the middle class. And when I say middle class, I also include those smaller businesses, because I understand that small businesses aren't going to be able to take that on. And that's what makes it basically unattractive to these small businesses with these different plans, because we've never had a perfect healthcare system, and that's what I think Bernie's trying, but I think everybody's trying to get that single payer. Will it work? I mean, we're the only country in the top 25 richest countries that doesn't have single payer. So what does single payer benefit us? I don't know.
I think being a country that has beliefs founded on like freedoms of like free market, like we're founded on the free market, laissez-faire, that kind of style. So to make the government bigger and have more control over the everyday people's lives, that's not something a large majority of the population feel comfortable with. So the question is, how do you offer like single payers the only health insurance that you can be covered under, or do you mix it with a little bit of single payer so you have that option that people can be covered with, or you have, you know, private insurance like Jared, who thinks that, you know, you'll have a better quality overall.
Okay, so that being said, is repealing the Affordable Care Act without a solution besides Bernie Sanders' plan really the best way to go about this?
Personally, I rather repeal the Affordable Care Act and install piecewise, like sort of piecewise measures in order to fix whatever underlying problems end up as a result of that. Because if you deregulate any sort of market, prices automatically are going to go down. The reason that healthcare is so expensive in the United States is because that, I mean, as much as, you know, the left side of the aisle will decry doctors, for example, or the government being involved in like women's reproductive rights and that, they have no problem with having the government being involved in a normal doctor's office.
Okay, but, sorry.
So if you repeal the Affordable Care Act, what do you do for the people that are currently on that do have these pre-existing conditions? What happens to them, like both sides? Like what do you think should be implemented in order for these people that are currently covered, that are really concerned that if this is repealed, that they're not going to have any coverage at all?
Let's not forget, there was a free market system before the Affordable Care Act, and these pre-existing conditions still weren't being treated.
Yeah, the reason they weren't being treated because they didn't want to treat them, and because like private insurance companies didn't want to treat them. So like what I would say single payers that Bernie is proposing is that all of those things would be covered. I mean, Republicans like to say those things would be covered, but it'd still be a higher price. So for my thing is that I believe personally healthcare should be free. That would be my perfect healthcare system. But at the same time, it would have to be taxed on to the rich and for it to be distributed to all. Because we do have enough money to pay for that.
But of course, we'd have to operationalize the rich, right? We'd have to operationalize what's considered a larger business versus a small business, because most of the legalese that goes into policies like this end up burdening the middle class who can't afford the lawyers that the larger corporations can.
And that's the problem.
Well, here's the thing on this. I mean, you say that we have enough money in order to do this. I know the left side of the aisle will cite the CBO reports when it comes to the number of people uninsured and that, but what they don't say is that according to the CBO themselves, Bernie Sanders' Medicare for All plan would cost approximately $32 trillion in the next 10 years. If you taxed every single person in the 1% at a 100% income tax, you would get approximately $616 billion. That would fund the program for approximately 4 months. So where are you going to get this money?
Right. Unfortunately, we are out of time, though I would love to pick this up again next week. That being said, thank you for watching Politically Charged, and we hope to see you again next time.